Okay, so our blood is made from the bone marrow. Okay, that's the little substance in the middle of the bone. Okay, white blood cells, also called leukocytes. You guys know that. They prevents infection. Okay, red blood cells carry oxygen, okay, and deliver carbon dioxide back to the lungs to be exhaled. Platelets are also called thrombocytes, okay? That's what helps control bleeding. That's a review for you guys, okay? This just shows here in the next slide the coagulation cascade. When we have damage, then the clot happens, and then we have fibrin for secondary hemostasis, okay? The clotting cascade. Here is the actual clotting cascade, okay? Where we have the blood vessels constrict, platelets adhere, platelets activate and aggregate, which means stick together. Okay, it triggers all those clotting factors. Then prothrombin converts to thrombin, fibrin converts to fibrinogen, okay, and we finally get some stabilized hemostasis, okay? All right, so in Peds, we're talking more about some of these disorders with blood, okay? The main one you're gonna see in Peds is iron deficiency anemia, and you may see some sickle cell, okay? Beta thalassemia, you may see, but it's not as prevalent as the others, okay? So for iron deficiency anemia, iron obviously is in our red blood cells, okay? We need iron for our hair, our nails, our skin, healthy function, okay? If we do not, usually because dietary changes, usually when we switch from formula to whole milk, okay, you will have that transition where the formula was fortified and now the whole milk is not, and you'll have kind of a washout, which gives you an opportunity to have iron deficiency anemia, okay? Usually at around 12 to 13 months old, the pediatrician will do a heel stick or a finger stick and test their hemoglobin, okay? If the hemoglobin's low, then they will do secondary iron studies, okay? Other risk factors for anemia as they get older, obviously kids are very picky. They do not eat a very healthy diet, okay? So again, and then when you start menstruation, they're at risk during adolescence, okay? Let's see here. Like we already said, if parents are doing any type of milk, whether it's whole milk, goat's milk, so don't let that throw you off. Soy milk, it's not the fortified formula, so it's still not going to have the iron stores, okay? And then children, if they're not eating meat, which we know a lot of those preschoolers maybe only eat chicken, they're not eating red meats, they have the potential to be iron deficient as well, okay? So iron deficiency anemia, you guys know some of these manifestations. They might be pale, their conjunctiva might be pale, okay? You can pull the lid down and look at that. Fatigue, tachycardia, shortness of breath with exertion, okay? Pica, you guys remember pica? What does that mean?
It's the like red, it's like fruit. Pica?
You remember, girls?
Pica's like eating dirt.
Yeah, eating dirt, eating ice, eating things that are not food objects because you're craving the iron that could be potentially in that object, okay? Again, one of the first things that we do is start iron supplementation, and iron in kids or babies, it usually comes in a liquid dropper form, and that iron can stain their teeth, okay? So those parents need to be educated to go to the dentist, to have cleanings, to brush their teeth, things like that, okay? This can also affect their mind, how much they can focus, their irritability at school. So those are things that need to be worked up, okay? Once they can tolerate oral pills or chewables, we try to switch to that. Okay. What's a side effect of iron replacement? Constipation. Okay, so they need to drink more fluids. What helps with iron absorption? Vitamin C. Vitamin C, that's usually a big NCLEX thing, is to pair it with vitamin C. Okay, Sierra, do you know that? See, she's like, oh yes. All right. Again, let's see where we at, 3 of 3. Okay. Offer them a lot of food objects, iron-rich foods, okay? Eggs, beans, lentils also have that besides red meat, because red meat can be expensive, okay? Moving right along. Let's see here. Again, talking to families, planning, remembering that iron can stain their teeth, okay? Giving them other ideas of iron-rich foods, printouts, and things like that, okay? Let's see. So prevention is obviously key. So moving on to sickle cell. You guys know sickle cell. We've talked about sickle cell. It's where the red blood cells sickle and they become like a moon crescent shape, okay? They can get stuck or adhere into the vessel wall, causing an occlusion or an occlusive crisis, okay? They have a shorter lifespan than normal red blood cells. Do you guys remember how long normal red blood cells live? Think about a test that we do in diabetics. That's a 3-month test. An A1C, okay? Because we're testing that. And the red blood cells live for around 90 days, 90 to 120, okay? But sickled cells live shorter lifespan, okay? All right, again, this is screened at birth with the heel stick. You guys know this. This is genetic disorder, okay? Inheritance of a single gene with the mutation. A lot of times this is seen more in African Americans, Hispanic, sometimes Mediterranean descent, okay? And then now you guys know that we tested a lot in all of our athletes, okay? It's an NAIA requirement. All right, again, same symptoms of anemia, pallor, fatigue, shortness of breath, okay? A vaso-occlusive crisis, though, that can happen in as small a vessel as the finger, okay? It's pretty much where they can have pain, swelling, and ischemia to that body part, okay? Because they're literally having an ischemic occlusive crisis, a thromboembolism, okay? They might, if they're active in sports, they might get short of breath faster. They might fatigue faster, okay? Remember, rehydration and oxygenation is the best thing to help prevent these cells from sickling, okay? And then pain management. These are gonna require narcotics, okay? So if you have a question on the test, it's not gonna be Toradol, it's gonna be morphine, Dilaudid, something like that, okay? Strong pain medications. Sometimes in severe, okay, they may require a blood transfusion because they can be severely anemic, okay? I know some of you guys had this on your test. Hydroxyurea. Hydroxyurea is one of the medications for treatment because it can prevent the sickling of the cells, okay? And reduce the pain and the vaso-occlusive crisis, okay? Hydroxyurea. You can use this drug for other things, but if you see it, just put it in your mind with sickle cell, okay? Bone marrow transplant, obviously, is the furthest in depth that you can go, okay? Again, we've kind of talked about this in adult too. So prevention is key, oxygenation, hydration, if they're playing sports, prevention. So if they have a fever, they're gonna need more oxygenation, more fluid intake, okay? So if a female's on her period, she's at higher risk, okay, to be anemic. Environmental factors, being too hot outside, okay? All right, let's see. So hydroxyurea, you guys have wrote that down. You have starred it in your mind. Okay, strong pain medicines, oxygen, and fluids. Okay. All right, we're gonna move on to beta thalassemia, also known as Cooley's anemia or Cooley anemia. Okay. Common single gene inherited disorder of the hemoglobin again. Okay. We have beta thal major, beta thal intermediate, and beta thal minor, okay? Minor is really not gonna require a lot, okay? If they're severely sick or dehydrated, they might have some symptoms, but other than that, they're not going to require blood products or anything like that, okay? This is seen in North African, Greek/Italian type descent, okay? They can have symptoms of anemia between 6 months to like 2 years old. And they need to then be screened for this, okay? So this is a peripheral blood smear or big name, hemoglobin electrophoresis, where they break down the different types of hemoglobin. Okay. All right, some treatments for this, especially for the intermediate and the major, okay, is blood transfusions at regular intervals, okay? This is something I feel like you might see on the NCLEX or ATI. It's called chelation therapy, okay? So chelation binds to the excess iron, okay? And then folic acid replacement, okay? All right, let me get here for you. All right, and these are the beta chains, okay? The beta chains of the hemoglobin, okay? This leads to ineffective production of the red blood cells and hemolysis, which is breakdown of the red blood cells, okay? This is a microcytic anemia for some of those who are very nerdy. So iron deficiency anemia is microcytic, and so is beta thal. It means they're small and pale. Okay, the red blood cells are small and pale. Okay, so for that chelation therapy, because if they've had so many blood transfusions, that also adds all this extra iron. They can also be at risk for like iron toxicity. Okay, and then the body has no way to get rid of excess iron, so you can have iron overload. So then the chelation therapy, okay, which the name for that is DEFER, DEFER, OX, OX, amine, AMINE, okay? And that's sub-Q or IV infusion, okay? So think of DEFER, if you see that, any type of, because there's other meds that are similar, but they have the first prefix of DEFER. So think of DEFER as a chelation agent that will clear iron from the body, okay? And guess what? What is the periodic table for iron? Anybody? Fe. Oh my gosh, DFE. There you go. So defer, okay? Any med that has that in the front. So remember iron, Fe, okay? It's to get the extra iron out because we're giving them blood transfusions because we need the RBC portion of it because they're severely anemic, like we're talking 4 and 6 hemoglobin, okay? All right.
Where did the folic acid replacement take place though?
All at the same time. Yep. So these are lifelong transfusions paired with chelation therapy, okay? So if you have to do teaching for a parent with beta thal, they're going to have lifelong therapy doing these things. It's not an easy thing, okay? And then iron can damage the kidney and the liver, so we do have to watch those organs and the organ function. All right, let's see. Again, a healthy diet where we can, but again, we don't want to involve too much iron in these kids because they're already going to need the red blood cell transfusion. So they're already going to be on chelation therapy. Okay. Let's see what else. All right. And so again, they're probably going to have a whole team assigned to them. They're going to see a hematologist. They're going to get their blood drawn. Okay. All right, so now we're going to some different anemias, okay, aplastic anemia, hemophilia, and then von Willebrand, okay, other blood disorders. So aplastic anemia is a serious condition of the blood that results from failure of the bone marrow to produce the red blood cells, okay? Or we should just say blood cells altogether, okay? So the clinical presentation there, everything's going to be down. White blood cells, platelets, and red blood cells. So that's aplastic, okay? It's not making, okay? We don't standardize screen this. It's usually picked up on normal screenings, okay? Usually due to some type of autoimmune disorder or exposure to virus. Remember that Epstein-Barr virus that we talked about with mono that can be so caustic and turn into cancer and other things like that, okay? All right, so again, very low white blood cells, platelets, and RBCs, so they are at risk for infection, they're at risk for bleeding, they're at risk for shortness of breath and anemia, okay? All right, if we think this is due to an autoimmune condition, what other meds may they be on? Talked about it like 2 weeks ago in adult 2. If this is believed to be due to an autoimmune condition, what kind of meds may they be on? Steroids, or how do you suppress the immune system? Immunosuppressive drugs, okay? Those DMARDs and stuff like that, what we talked about, okay? All right, sometimes they can get a bone marrow transplant, okay? All right, there's no prevention because again, it can happen from viral, it can happen from autoimmune, okay? So supportive measures, making sure they're not getting hurt, they're not doing something to have splenic injury or bleed out, okay? We don't want them to give unpasteurized foods because they can get sick and get foodborne illnesses so frequently, okay? Dental work, they gotta be careful to make sure that they're not gonna bleed out, they are not higher risk for infection, okay? So a big, big thing for that, okay? All right, so aplastic, A without, okay, all of the cells, okay? Red blood cells, platelets, RBCs. All right, hemophilia, again, we've talked about this in a little bit in the other ones. Hemophilia A is insufficient factor 8, so that's a clotting factor, okay? And then hemophilia B could be potentially absent, okay? Hemophilia is a bleeding disorder, okay? So they're going to bleed, okay? Due to lack of clotting factors, okay? A lot of times this is due to spontaneous genetic malformation, okay? We don't typically test this, but it's tested if somebody comes in with complaints of severe bleeding. Maybe it's a female with her period that are going 3 months long, okay? Or heavy, more than normal bleeding, okay? This is X-linked, okay? So males are going to be more affected than females, okay? Females may just be a carrier, okay? All right, so I will tell you this can be picked up due to prolonged PTTs, okay? That's your bleeding time. That's how long it takes you to clot. So if I poke your finger and you bleed, and your INR, PT, PTT are way off the charts, you have a problem clotting, okay? That makes sense? We put people on anticoagulation meds to thin out their blood so they don't develop clots. This is pretty much like the person is on anticoagulation, okay? All right, again, in kids, because they're active, they can have bleeding into the joints, okay? They can have bleeding into the belly if they have an injury, okay? These kids have to be taught how to have like soft toothbrushes, all the bleeding things. Remember when we talked about the liver patient and bleeding and same concept? It's all the same things, okay? This is how it can cross over and you can put all this stuff together, okay? All right, see what else, okay? Psychosocial development, all of these types of things, health promotion and disease prevention. Again, same kind of things that we've talked about, okay? Preventing injury, making sure they are on hopefully medication before surgery, okay? All right. Sometimes this is found out during surgery. Wouldn't that be a bad time to find out? So, all right. Von Willebrand is another type of disorder, okay? This is where blood does not clot appropriately due to low levels of the von Willebrand factor. It's a clotting cascade factor, okay? With factor 8, okay? And again, it causes increased risk for bleeding, okay? This is autosomal dominant. However, there are some autosomal recessive traits where they can just have like carrier, okay? Again, same thing, and a lot of times this is found out with heavy menstrual cycles in females, okay? A lot of times they'll be sent to a hematologist for further testing, okay? Because they can look for the actual factor to find out, okay, which one it is, things like that. So same type of thing, okay? We're protecting them from injury, soft toothbrushes, all of that type of stuff, okay? That's just some other links you can look for von Willebrand's disease. Okay. All right. ITP, immune thrombocytopenia, ITP, okay? This is a platelet disorder that affects the ability of the platelets to bind together, okay? Pretty much autoantibodies cause the platelet to destruct and shorten the lifespan, okay? All right. Resulting in low platelets, okay? So we're destroying our platelets faster than we can form them. Sometimes you can see this as a result of cancer, as a result of a viral infection, such as Epstein-Barr virus. Okay, there it is again. Okay. Autoimmune, such as lupus. Okay, so it can be a or a concomitant diagnosis with another diagnosis. Okay. All right. 60% of those diagnosed in childhood follow a viral infection, okay? So we're talking platelets less than 100,000, okay? Normal platelets are 150 to 400,000, okay? A lot of these patients will go into remission, okay? If this was caused by a virus, eventually the body may be able to correct itself. Okay, so that is something that is possible for them to go into remission. Okay, treatment is based on how severe or if they are bleeding. Okay, so if it means a platelet transfusion. Okay, usually we don't really transfuse people unless they're less than 25,000 of platelets. It's just all about monitoring them, putting in a bubble so they don't have injury. Okay. All right, again, some of the same things that we talked about, okay? So the biggest thing that we pointed out to this one is that it can be self-limiting and it can go into remission, yes? For ITP. All right, so what kind of activities or after-school activities are we gonna allow this kid to be in? Yeah.
Their platelets don't work. So
yeah.
Something simple.
Yeah. Chess, gaming, playing guitar, doing something, piano that's not an exertional activity. Okay. All right. What are you talking? I talked about this. Okay. DIC. I'll be super quick with DIC because we've driven this home in OB. Okay. You guys know this begins with there's tissue damage. It causes activation of the coagulation cascade, which causes overclotting. And then we run out of our fibrin stores, and therefore we start to bleed everywhere under our skin, in our organs, from our eyes, from our nose, from our mouth, okay? And then it will result in organ failure, okay? All right, risk factors, we know it could be severe injury, pregnancy, okay? Cancer sometimes can cause this. And again, viruses, okay? All right, and remember the treatment is very, how do we talk about it? Ethical, remember? Because if you catch it early, you might be able to give them like heparin, but if you wait too long, then they're already in that bleeding out. So a lot of times it's supportive care, okay? Treating the underlying problem, if it's delivering the baby, if it's treating sepsis, okay? If it was a snake bite. We haven't really talked about snake bites, but snake bites, severe venomous snake bites can put people into DIC, okay? In case you see that on NCLEX or ATI, okay? We might need to give them platelets. We might need to give them what else? Do you remember? The cryo precipitate. Yep, the cryo. All right, so again, we're gonna be looking at their platelets, their CBC, their D-dimer, all of those things, okay? And remember, this is an acute disorder here. All right. Couple other cancers we've talked about before, okay? Neutropenia. I know some of you guys had a neutropenic type question, an isolation question on ATI, okay? And it was a positive pressure room instead of negative pressure, okay? So for neutropenic precautions, that's low white blood cell, which means immune system is vulnerable, okay? There you go, low white blood cells, okay? This can be benign, it can be medication induced, okay? It can be congenital, or it could be due to some type of cancer or treatment for cancer, okay? So it just means low white blood cells, okay? So obviously they are at risk for infection. We have to protect them from infection, okay? They need good oral care to prevent mouth infections, okay? They need to stay up to date on their vaccines, preferably when their white blood cell count is at its highest, okay? All right, lots of hand washing, all those precautions if they're sick, okay? Protective positive pressure isolation, no fresh flowers, no fresh fruits, no unpasteurized foods for these people, okay? These are gonna live in a bubble, okay? All right, so that can be hard, especially if it's a kid, guys. Remember, we're talking about all of this in regards to a kid, okay? All right, leukemia, okay? We did talk about CML, remember? We might have talked briefly about ALL, okay? Acute lymphoblastic leukemia, okay? And then acute myeloid leukemia, okay? So remember, these that are acute, okay, is more related to peds, okay? ALL is the most common childhood malignancy. I will repeat, ALL is the most common childhood malignancy, okay? They think it could be linked to other genetic things, that it turns it on, okay? Super sad. So they can present with bruising, bleeding, fevers, joint pain, fatigue, okay? Swollen lymph nodes. Okay, so lymph nodes that are not going back down, usually after 4 weeks, need to be investigated, okay? They're gonna look at the CBC and the differential. Remember the differential at the bottom? It tells you the percent of all the different cells, okay? They're gonna be looking at that. They're gonna look at the morphology of the different white blood cells. We call that the peripheral smear, okay? And then bone marrow biopsy, okay? For AML, myeloid leukemia, one thing for this is that there's blast or baby white blood cells seen on the peripheral smear or seen in the bone marrow. Okay, those are baby white blood cells because the body doesn't have enough, so it's trying to push out immature blood cells. Okay. And unfortunately, the treatment for both of these are chemotherapy, okay? To achieve remission and then start to get normal white blood cell production, okay? All right, and then all the things that go with chemo, okay? All right, a lot of these patients will have central venous access, whether that's a PICC line, if it's a port. Most of the time we know this as a port, so we're not sticking these kids over and over, okay? Hygiene is super important to teach these. A lot of times they'll have to be homeschooled because of the likelihood of infections. So then that leads you into a whole psychosocial realm, okay? If they're adolescents, they got to be told about safe sex, condom use, okay? Increased risk of infection, UTI. I think you guys, there's extra module 24 on leukemia specifically in peds. If you want to look over that, if you have more questions on it. Other than that, that is it for our hematology section. Okay, wrapping that up right at the